In today's video, we are going to discuss Mike Majlak's $2,000 hair transplant which he underwent in Turkey. What we think about, how was his planning, how was his procedure being done. We will sort of dissect the video, discussing the scientific parts of his hair transplant rather than the other parts. We will let you know what we think about it. As the title itself suggests, it's a low-cost hair transplant which he underwent in Turkey.
My hair is thinning, I'll be completely honest. I'm getting my whole done like in the back and a little bit in the front for like $2,000 US.
So initially he says that he's going to get a hair transplant done where he shows off his scalp and its baldness, and it probably looks like a Norwood grade 3 male pattern baldness.
Probably 10 years ago, I started getting thin in the back. Not like crazy, not like bald, not skin, but thin. This seemed like a good solution.
And he says that he started having some hair thinning or hair fall around 10 years back. So that's a long time to consider. It's a slowly progressive male pattern baldness where the sides have receded and there is some thinning here all over till the crown. Apparently it looks like a Norwood grade 3 male pattern baldness. We see that the hairline is already drawn. In another clip in the video, we see that the hairline is drawn and he is undergoing a trimming of the hair. So after the trimming is done, we see that the hairline which has been marked appears to be straight line. There are hardly any irregularities there. And as we all know that hairline is never ever straight. It's always irregular and there are micro and macro irregularities in the hairline, and it gently curves toward the side with those micro and macro irregularities. The hairline itself is soft and then the density is added on after a couple of rows of insertion of single hair soft follicular units. So this, we feel that the hairline is on the straighter side. It should have been more irregular. Then there is a small clip showing the surgeon who is performing the hair transplant for him. The exact steps are not shown in the video, what all steps were done, how the number of grafts were decided, how many grafts were required, how did the clinic or the doctor came to this conclusion, and what was the quality of his grafts and what kind of results he can expect. So this is something, if it was there, it would have been more scientific way of approaching, but definitely this thing, we understand that this must have been done prior to the actual surgery by the doctor. A small clip is shown and then he further describes the steps in his own way. All the surgical steps have been described. The first step Mike describes, is the local anesthesia.
The anesthesia is painful. They stick a full needle into your head in different spots.
So here he shows with his fingers that full length needle was stuck. So friends, the needle are never this long and it's not stuck like this. In general, all the standard good clinics use a very fine, almost I would say 26 to 30 gauge needle to give the local anesthesia. And when they are giving local anesthesia, we as hair transplant surgeons can predict or foresee that there is going to be some discomfort or pain during giving the local anesthesia. So we use vibration devices, cool tip devices, sometimes ice is also used. So with those kind of steps, we can actually minimize the pain which goes along with the insertion of the or giving the local anesthesia. So it's not that dangerous or that gross or that painful as he is describing if the standard needles and the local anesthesia is given in a standardized way.
Then they go and actually pull the hairs out from the donor area. So I got 4,500 grafts done. So they individually pulled out 4,500 hairs from my head.
Then further on he describes that the grafts were pulled out. So they are not pulled out. There is a machine, a few machine is there which is foot controlled or sometimes thumb or finger controlled also, and from that machine there is a handpiece attached to it, and on that handpiece is mounted a punch which is generally 0.8 to 0.9 millimeter or sometimes very rarely 1 millimeter in size also. And then these punches, they extract individual graft. These punches are very sharp. They go inside the skin to the depth of the root where the follicular unit or the graft or the root is attached to the nearby structure. And one of the most important tethering structure is the erectropyly muscle. This muscle holds the grafts inside the skin, and once the skin is cut, epidermis is cut and the muscle is cut, the roots themselves pop out, and all that needs is the gentle collection using atraumatic forceps or atraumatic jeweler's forceps, or there are typical ATUE forceps for the collection of these grafts as well. So it's not exactly pulling, healing, but it is extraction of the graft. And he says that 4,500 graft at one place and other place 4,500 hairs. So I think it is graft because, as he himself said, that the transplant is done till the crown area. So each graft can have 1 to 4 hairs. On an average, there are 2 hairs per graft. So had it been 4,500 hairs, that means around 2,500 grafts, 2,200 to 2,500 grafts. But we can't cover such a big area with this lesser number of grafts. So in all probability, he's talking about 4,500 grafts to cover this area, and the graft extraction is done by FUE or follicular unit excision or extraction method in his case. And post procedure, he is seen to be going out in a sun, having hookah and things like that, which we would not recommend you to do that. Smoking and drinking should be avoided till the healing is completed. And if you really do want to take it, it should be in the minimum or the moderate quantity, and alcohol content should also be strictly avoided. And if you can avoid, the healing is going to be better in your case.
The results are pretty good and it's super worth it.
He also considers this procedure to be worth it because this is going to give him back his hairs which he has lost, and we think that he should be very strictly taking the medical treatment like finasteride and minoxidil and things like that, so that he can prevent further hair loss of the existing hairs, and along with that the newly transplanted hairs would also come out nicely, or they will grow nicely. Then coming to the recovery part, at 3 months it is shown that he is having a good recovery. He can feel some of his hairs coming out after the transplant at around 3 months, and this is quite typical. At 3 months we can start feeling the new hairs coming out. You can feel sort of spikes coming out. After 3 months, slowly every month you get around 10 to 15% hairs coming out. Initially these hairs which are coming out are thinner and softer, and they keep on getting thicker, and new hairs keep on coming out after 3 months, and this keeps on happening till 1 year. So the recovery seems to be uneventful. The procedure seems to be performed nicely. The only drawback in our opinion is that the hairline is on the straighter side. It should have been much more irregular, but definitely he is going to benefit by this procedure, and we wish him all the best for his procedure. We will keep on making such videos. If you are also looking out for a hair transplant for yourself, or looking out for a hair transplant solution for yourself, you can WhatsApp your pictures on the numbers given here, and our team will try to reach out to you regarding your hair loss problems and a solution to that. If you want to see one of our results, you can click the video on the right, and if you want to know the factors which actually affect the cost of a hair transplant, you can click the video on the left.